Our guest today became the bureau chief for the Cook County Bureau of Health Services in January 2007. Prior to that, he was appointed chairman of emergency medicine at Cook County John Stroger Hospital. In 1995, our guest today became executive chair of emergency medicine at Rush University Medical Center in Cook County. Our guest today, now listen to this closely, runs the largest department of emergency medicine in the country. One more time. The largest department of emergency medicine in the country, with over 250,000 patients annually. 250,000 patients annually, and almost 100 faculty and 54 residents. Our guest today completed his residency in emergency medicine at the University of Chicago in 1980. Ladies and gentlemen, please welcome to the City Club of Chicago, Dr. Robert Simon. Doctor?
Oh, sorry about that. I'll just put this in my pocket. Thank you. Thank you so much. Thank you, everybody. I think what I'm going to show you on the slides today, I think is going to surprise those of you who haven't seen these slides. And I think is going to kind of shock some of you, because most of you, if you read the papers, you get a misrepresentation totally of what's really going on at the county hospital and the county system. What I'm going to do is take about 20 minutes to go over this presentation, and then I'll answer any questions you have. And I have no problem if you ask me a challenging question. I'm kind of used to that nowadays. The Bureau of Health Services, is this too loud? Is this okay? Okay. Is the third largest public hospital system in the nation. It's the largest provider for the uninsured, underinsured, and Medicaid populations in the state of Illinois. When I took over January 5th, all of these positions, I put in new people or moved people. The CIO, COO of Provident was moved from another site. CFO of the Bureau is brand new, recruited from the outside. CFO of Stroger is new, doing a great job, Provident. All of these people have been moved. I don't think any of them, by the way, live in the 8th Ward. There was no interference whatsoever in putting this together. So I want to just comment on that so that Commissioner Suffredin is aware of that. When we took over the county hospital system, the directive that I received is that restructure everything you have to restructure in order to reduce the budget and preserve essential services. Now imagine having a budget of around $800 million, going in and having to cut $100 million. Actually, the request was $130 million, and yet preserve essential services. That's a pretty hard thing to do. And then to complicate it further, to do it as a line item budget, which is virtually unheard of. So what I did is I approached this the way I do overseas in war zones. I basically set up a crisis intervention team of 22 people. We then looked at the entire system and we restructured. And here's what we did. In 46 departments, 23 major ones, this is what we did. We took these systems, management systems, we reduced them, combined them, and we restructured them like this in 23 departments. Here's nursing at Stroger Hospital. Eliminated or combined those areas, reduced it to this. In total, we achieved a 6-to-1 ratio of management to line worker cuts. That's the best ratio of any place in the country that has had to restructure. It's better than General Motors did when they restructured. It's better than Boeing did when they restructured, or United Airlines. No one has achieved that ratio. Now, that's not because of me. It's because of the 22 people that were on the crisis team. In 2006, before the crisis and the $100 million cuts, we saw 774,000 patients. We continue to have the capacity, after cutting out, I think it was 10 or 12, 13 clinics, we continue to have the capacity to take care of 95% of the patients. If we had the providers, if we had the nursing staff, we have the capacity. In other words, all the clinics we closed accounted for 5% of our patients. Only 5%. When you hear people talk about the destruction of primary care It's basically combining things. How else do you reduce 100 million? You got to consolidate. So the total amount was 5%. Do you know how much we've seen this year, in this year of crisis? 665,000. You would think we shut the system down, reading the newspapers. 665,000. Do you know that our Stroger census is the same as it was before? You'd think that we've lost 2 or 3 wards. The ER visits is the same. All of the quality services are identical with what they were before. We've reduced Provident in size, and we've reduced Oak Forest by long-term care. That's essentially what we've done. But look at these numbers. They're astronomical. 18,000 prescriptions a day. Our ER, if you combine all of the ERs and the walk-in, what normally people think of as urgent care, it's 250,000. Another 500,000 is at, another 50,000 is at Provident, and then what isn't shown here is another 30,000 is at Oak Forest. Now the budget was reduced by this amount, and I want to keep this at 20 minutes, so I want to go fast through these so you have time for questions. The total reduction in the budget will be, by the end of the year, about $98 million, almost $100 million. We'll be off target by maybe about $20 million, and that's only because of the bad publicity produced partly by Commissioner Suffredin and Claypool, who basically, and I hate to use names, I'm not a politician, but the reality, the truth has to be known. And I know I'm being taped, and hopefully this will be broadcast on Saturday. I need them to show me, and I've challenged them and asked them, can you show me any other system in the country, any other hospital system that has cut what we've cut in 1 year? The audacity of certain board members to say, you know, we can't believe you. We can't believe anybody anymore because for 20 years we've been misled. Well, you know what I told them yesterday? I told them, you know what, for 19 years I've been misled. I thought everything was going fine. The fact is that if I'm misleading you, it would show up in the controller's office. There wouldn't be these reductions. There wouldn't be these changes. I mean, that's how you can tell. Don't even believe me. Just look at those. Even in this year of crisis, what we have been able to do is go from 12 to 24 rooms in our busiest ambulatory clinic. We've doubled our room capacity. The call center receives 400 to 500 calls a day for the 750,000 visits in its clinics. It used to be 20 minutes wait time. Now it's 2.5 minutes. They've revitalized the entire call center. And pharmacy is unbelievable. We do 18,000 prescriptions a day. We have a 43% vacancy rate in managers. 43% vacancy rate. The pharmacy department, those managers that were left, they reduced the budget by $17 million from last year. So from 2006 to 2007, filling roughly the same number of prescriptions, they reduced it by $17 million. How was that done? Many of you are in healthcare and know this. MAP, the MAP system. They took over the MAP system instead of outsourcing it, saved $5 million. They combined different, what do you call it, when you have a pharmacy at Oak Forest, a pharmacy at Provident, pharmacy everywhere. They combined them under one system. They reduced overtime by 50%. Now, you know how they were awarded yesterday? Yesterday, all of the managers, listen to this is amazing. They produced 84 amendments. Forget about all the racism and all that bullshit. I'm sorry. Let's look at reality. They produced 84 amendments, guys. You know what they passed? They brought the budget down by $1 million from, I think, $239 million to $238 million deficit. That's what they did. Spending the entire day for $1 million. You want to know where the $1 million was? The majority of it was, and those of you in this room who are from my shop, unfortunately don't know this, they've taken away the COLAs, the cost of living increases, for all the people that make over $80,000 a year, all my managers. So my pharmacy managers who saved $17 million, among many other managers here, they've taken away your COLAs so that they could save $600,000. What insanity. You know what that tells all the good managers, many of whom are in this room? Go and find another job. In fact, one of the people who's in this room already found another job because she's sick and tired of it. And she's in this room. So, Commissioner Suffredin, who introduced that amendment, you saved $600,000, and you're going to be the reason why many of my managers are going to leave. And how shame on you, Board of Directors, for passing that budget, for passing that ridiculous resolution to save $600,000. Shame on you. They reduced the wait times. With this kind of vacancy rate, pharmacy reduced the wait times by 30 to 40%. Where is Fox News? They certainly came in January to watch our huge waiting lines in pharmacy. They taped it. Everybody knows about our pharmacy wait lines. I said, give us a few months and come back. They never came back. Never. The wait lines are down. There's not the huge lines, even with the vacancy rate. Now look at it. This is what's going to shock you. We're the largest provider of cancer care in the entire state of Illinois. Greater than 100% increase in volume in the past 18 months, yet with a reduced budget. Look at the number of new cancer cases, 1,700 that we take care of, versus U of C, Loyola Advocate, U of I. Look at the number, 1,700, largest in the state. You would think, with the low number of providers, I think we only have 9 cancer doctors. I think we have 2 cancer surgeons. You think with all of this, that our data, our statistics, our quality must be pretty low. The blue line is the U.S. average survival, and I haven't picked rare cancers. I picked the common ones, and I picked them all stage 2. Breast, colon, lung. We exceed the national standard in survival. Isn't that remarkable? Thank you, but you know what? That credit doesn't go at all to me. It goes to those doctors and nurses. The former president of the nursing union is here today, Mary Chisholm, and she's phenomenal. Cardiovascular surgery. Look at this, folks. Here's the national mortality rate. So for those of you who aren't doctors, when you have heart surgery, a certain number of people die or have morbidities, right? Well, this is the national average. 2.6% have mortality or morbidity with major heart surgery. In public hospitals, because people come in sicker and later, it's a little bit higher, 2.8. Ours is 2.1, the lowest of any public hospital in the country. Look at how many FTE surgeons we have, 1.5. That means our surgeon is on call 25 days out of the month. That's a guy who Commissioner Suffredin reduced COLAs to. I'm going to have a hell of a time keeping him, unless one of the commissioners can try to get that overturned. For $600,000, it's not the money, it's a few $1,000s. It's the principle. I'm going to have a hell of a time keeping the rest of the people that didn't leave that are in this room. Department of Medicine, largest non-university residency in the country, 100% board certification, top 20 nationally. Pediatrics, all of you in this room have relatives with asthma. All of you know that if you're doing a good job with asthma, basically what happens is they don't have to come to the emergency room. So if I take care of your asthma well, you don't come to the emergency room and you're not hospitalized. So the way to tell if you're doing good is hospitalization and ER visits. Stroger Hospital, this is the national average, and this is ours, our ER visits. Here's ours, here's the national. Here's ours, here's the national. Isn't that amazing? Look at the Child Protective Services, the largest provider of evaluation for abused and neglected kids in the entire state, second largest in the country. Largest in the state, second largest in the country. Now, when you take care of abused kids, you have a high recidivism rate, right? I mean, you put them back with their families, and they're abused again. Here's the national average, 7 to 20%. Look at ours, 1.9%. All of these people that are responsible for this, social workers, mental health specialists, all of them make over $80,000. Commissioner Suffredin just reduced their COLAs. I'm sure I'm going to lose some of those people. Thank you, Commissioner. Neonatology, 10 perinatal centers in the entire state, 600 in the country. Look at where Cook County Hospital is compared to the national average in birth weight. We have lower birth weight kids, so then we should have a higher mortality, right? Common sense. Look at our mortality on the national average. It's amazing, isn't it? Mortality, national average is blue. Discharge rate home. Core Center, this is really remarkable. And this is something that Dr. Goodman is partly responsible for starting. The Core Center, we see 1 out of every 3 HIV patients in the entire city of Chicago, 1 out of 20 in the entire state of Illinois. Isn't that amazing? 1 out of 20 in the entire state. The results are phenomenal. Now this is really going to shock you. This actually shocked me. Dr. Goldberg and the Department of Medicine did all the research to find this out. I had no idea of this. I didn't know we took care of 1 out of 4 TB patients in the entire city, county of Cook, rather. I knew about the HIV, of course. We take care of 1 out of 19 cancer patients in the entire county. 1 out of 19. Diabetes, we take care of 1 out of 9. 1 out of 9 diabetics in the county of Cook come to our facilities. Emergency rooms, we take care of 1 out of 10 visits. The ambulatory clinics, 1 out of 20. Now, for those of you who keep hearing about how, well, we must be really inefficient, we're bloated with patronage employees, Commissioner Claypool, Commissioner Sufferton, bloated, Commissioner Pareka, who nobody on the board respects anyway. But in any case, I know I probably shouldn't say those things, but that's okay. I always say what I mean, and that'll never change, and I don't want it to change. Huh? Yeah, I don't, I think if people elected people, frankly, if I could elect somebody who spoke what he thought, I at least know what is there. I know what I'm getting, And so I'm going to continue saying what I'm going to say, because I'm never going to run for office. But in any case, look at our expenditures. Look at our expenditures, guys. We take care of, this is amazing, 7% of these diseases for the entire county of Cook, right? 7%. Our cost is 2.5%. Why is this slide so important? You keep hearing of bloating, patronage, that the budget is bloated. Why can't you live with an $800 million budget with all these services, 1 million people? If we were so bloated, what that means is that Northwestern, who is here, University of Chicago, who is here, Rush, who is here, and all the other hospitals, Norwegian, everybody who's here, is more bloated because our expenditures for the total number of patients is 2.5% of the entire counties. In other words, the county spends, I don't know where he put this, but I thought it was like 38 billion or something. It's some huge number that accounts for 7% of the total that we see. I mean, that's incredible. Now, our trauma center, 74% is blunt. I mean, blunt, for those of you who are not doctors or nurses, is people that fall off of ladders, car accidents. It's not the gunshot wounds. Look at our survival rate, the highest in the country, 99.5%. We see 40% of all the trauma in the entire region of Cook. Oak Forest Hospital, ventilator unit, rehab unit. You hardly ever hear anything in the papers about these two facilities. Look at the number of patients, the national average in our ventilator unit of weaned patients off of ventilators. This is Oak Forest, it exceeds the national average. In the rehab center, Oak Forest Hospital has achieved a better result than, equal result to RIC, equal to RIC in its rehab center. Now look at what else Oak Forest has. Look at the number of poor people. The darker this is, the more poor people around Oak Forest. Oak Forest is right around here, I think. So you could see the poverty is higher around Oak Forest and it's increasing. Look at the ER visits, logarithmical growth. And even though the ER is kind of in a hidden area, I mean, it's really hard to get to. You have to go through a security guard. Now, we can't control medical inflation. We can't control the cost of new pharmaceuticals, new technology, capital equipment, energy costs. All these things are going up. We can't control it. We can't control the fact that there's so many underinsured and uninsured. Immigrant population is increasing. None of those things can we control. There's no dentists. That's the other thing. I had to eliminate dentistry, not because I wanted to. I didn't want to eliminate primary care. Didn't want to eliminate dentistry. You know how many calls we get a day for dentistry? 600. Because there's no place for a person who works at Subway or McDonald's or this place who may not have insurance for its regular employees. The guy who opens the door, maybe the guy who works in the bar sets us up, maybe he doesn't have insurance. Or maybe if he does, he has some minimal insurance. And they certainly don't have dental insurance. 600 a day, there's no place to send them. I had to eliminate all dentistry. I'd like to restore it, but I can't. I can't because I only have 7 commissioners who will vote for what I need, who have the courage that our Berman did. I had a chance to talk to him about taxes. Here's what the county of Cook pays for public health. Here's what Parkland and Grady pays. Productivity. Again, I showed you that we take care of 7% total in those diseases of the county Our budget is 2.5% for those diseases of other public hospitals. So that should show that we're pretty efficient. This is even a better way to look at it. We applied the Harvard Relative Value Unit scale, and that looks at nursing care, doctor care for gallbladders, for high blood pressure clinic visit. I think that's, high blood pressure clinic visit is a 1 rating, I think. Other things are 110 ratings. It depends on how much you have. So, and it's applied everywhere. Medicare uses a scale. Everybody uses it, right? So it's a pretty reliable scale. The higher the number, the more productive you are, the more efficient you are. Now look at ours. We did this, and I asked every commissioner. I showed this to every commissioner. I asked every one of them, please, send your staff so that they can sit with my staff, my statisticians, and we'll show you the data, and you can challenge it. There's nothing to hide here. It's all pretty open. Look at our productivity. After the cuts. This is after the cuts. 308. Parkland's is at 262. Grady is higher, but you know why? Look at their length of stay. 10. Ours is the lowest of all of these hospitals. So we are more efficient, not less, Commissioner Sufferton, than Parkland, Grady, LA County, Hennepin, which is a very well-run hospital, Jackson, Harborview, a well-run hospital, UCLA, or Cincinnati. We just compared ourselves to a couple of universities and the rest here. And so you could see we're pretty efficient. So the bottom line is if you're pretty efficient on the Harvard Relative Value Units, you may have employees that are excessive, but you know what, so do others. And so that means you need more money. You know, that's what that really means. And this you already know. And these are all the references. So I wanted to keep this short so I can answer your questions, but I want to say a couple of more things and I'll be done. I think what's important for you to know is that the information I've just told you, and I wish there were newspapers here. If any of you have access to newspapers, if any of you have access, not to the editorial boards, we've been to them twice. We've had a couple of people from Sun-Times and Tribune come over and look at the stuff. And they've seen this same presentation, but nothing has come in the papers. But if any of you have access to where you can get to a newspaper where they can publish the truth, you know, the county would certainly appreciate it. I would certainly appreciate it. We take care of 1 million poor people. And you know, I want to tell you something about poor people. All of you in this room know this, but I think the public doesn't. And since this is going to be aired on television, I want to be sure it's clear. Out of the 46.5 million Americans that have no health insurance, 8 out of 10, that's 8 out of 10, are working families. That's what people don't realize. They think they're all unemployed. All unemployed. In our facility, it's 84% are the working poor. Folks, everyone in this room goes to a Subway. Everyone goes to a White Hen. Everyone sees these people here. If those people have no insurance, where are they going to go when they get cancer? Well, let me tell you some of the data that also, oh, by the way, where that comes from? A Primer Kaiser Commission, 2007. When they closed the public hospitals in Philadelphia, St. Louis, Cleveland, and then in Detroit, here's what happened. In Detroit was the worst. They had 42 hospitals before, they now have 8 in the city of Detroit. In Philadelphia, 9 hospitals shut down after closure. This, to me, is horrific. This is horrific. Stage 3 and 4 cancer, it went up by 20% in the first year. Pap smears in women, prostate cancer in men, was not diagnosed until a much later stage, and 40%. By the way, where does that come from? Kaiser Network, Philadelphia Unemployment Project, Philadelphia Inquirer, and the American Cancer Society. Anyway, so, and I can go more and more. Heart disease, diabetes, complications of diabetes, all of those were excessive. So, I want to thank several people. I want you to know who has the courage to do what Art Berman, who's here, had the courage to do. Art Berman, as you know, was a senator for 30 years. And Art Berman raised taxes. And you know how he did? And he always got reelected. And that's what Commissioner Butler used to tell me. And what he told me is he said, you know what, all you have to do is explain to people. I was in education. And if you show people that you haven't had a raise for the teachers or buildings funded or anything increased for 10 years, they usually vote to raise the millage. I mean, if they're just showing the logic, and that's what I depend on the newspapers to do, but they're misleading you. They're misleading all of us. And I have no idea how to change it. I'll never forget, before I finish this thank you list, I'll never forget, and you will never forget, that when Atlanta, Georgia had the Olympics, there was a guy who was blamed for some bomb that went off. Every one of you in this room is old enough to remember that. And it was on all the headlines. They had his picture. They had his name. The FBI had caught a guy who did the bombing. And about a month or a month and a half later, I'll never forget, they caught the wrong guy. They destroyed this guy's life. He was in Oregon at the time. Ladies and gentlemen, the free press we have, it may be free, but you know something? It's not accurate. None of this gets out. And what has to happen in our society, what has to happen in our community, is we have to stop being a soap opera community. We have to stop looking at the headlines of this guy says this about somebody else. Simon says the word bullshit in the city club. Whatever it is, whatever the game is, we have to start looking at the facts and reality, and we have to try to hope that a paper or papers or the media somehow will generate the truth. And that's the thing. And I want to end by thanking these commissioners who have the courage that Art Berman had. And I want you to know who they are, because these are the commissioners that have the courage. None of these people would get reelected for voting for taxes for this healthcare system. Commissioner Butler, Commissioner Sims, Commissioner Murphy, Commissioner Steele, Commissioner Beavers, Commissioner Moreno, and Commissioner Daley. Commissioner Daley yesterday told them, you know, you guys, you've reduced the budget by $1 million only. You have a $238 million left on Friday. Either find that or you're going to have to vote for taxes, or you decide what to cut. And I've told them, I will not cut anything. I'll give you the list. You see what it costs. You want to cut cancer care? No problem. Destroy it. Destroy it. You know? And I think what you can do in this room that would really be helpful, don't even bother contacting these commissioners other than to maybe say thank you. But really try to contact, and don't waste your time with Sufferton and Claypool. I want to end by saying to you, and saying to them publicly, Commissioner Claypool, I've already challenged you to one debate. I won hands down. Even your own people admitted that I won. And it wasn't hard. I didn't even have to hardly prepare. Commissioner Sufferton, you're a lawyer. I'm just nothing but a simple country doctor. Commissioner Sufferton, I challenge you to a debate, but on a much larger scale. You're running for state's attorney. I challenge you because I want the people of this state to know what you really are. You've given false information. You've falsified data. You've inaccurately represented what's going on. You voted for COLAs, and then yesterday you took them away. You're a hypocrite, and I'm challenging you publicly to a large debate so that the people that are voting for state's attorney know who you really are. And I hope you accept that challenge. And the last thank you I want to make is a big thank you to the Blue Ribbon Committee. Everything they did, and people say that I don't like the HMA study, whatever it is. It's not that I don't like it. You can't compare a study that was paid for by one that wasn't. And you know, the bottom line is no one. The Blue Ribbon Committee is like putting former President Gerald Ford and Carter in charge of something and saying, you know, this is political. Well, you know, both of those guys are pretty highly respected. And the Blue Ribbon Committee is very, very highly respected people. And their report, they did it without any money. They met 28 times. They thoroughly investigated everything. And they said, we are in a real crisis. You need money. And they had recommended an independent governance board, which I totally support. And they said, take nothing more out of the system because you'll destroy it. Morale is that low. So I want to thank you, Larry Goodman. Could you stand up, Larry? And I want to thank the entire committee. I don't know if anybody else is here from the committee, but I want to thank the entire committee for a phenomenal job, tremendous amount of work for nothing. And lastly, in terms of patronage employees, there's two people I want to tell you about that these people keep talking about. I have 300 private patients. One of them happened to be President Stroger. Of my private patients, 3/4 of them are uninsured people that work. The other quarter are VIPs, like Stroger. And the bottom line is it's unfortunate but I'm not a patronage employee, and I don't live in the 8th Ward. And the other thing that I wanted to tell you is that I think is important for you to know is that if I were to pick a CFO, and I then came to the board and I said, you know what? I found a CFO. It's a Northwestern graduate, School of Business with honors. And in addition, it's even better. She's a black female. She's a black female that worked while going to Northwestern, one of the best business schools in the country, and graduated with honors. Anybody would say, Dr. Simon, thank you. Even Suffredin would say thank you, I think. Well, you know something? That's who our CFO is. I mean, you know, it's amazing. That's not patronage. That's picking the best person for the job. You know, so in any case, I want to end with that. And I just want to thank one more person who absolutely hates coming to these things, but she is literally my right hand. And Michelle, can you stand up? She's my administrator. And I'll answer any questions, and please make him challenging. Happy to do it. Yes, sir. Sure.
Just go to the microphone and state your name. I forgot, I'm glad he acknowledged Dr. Goodman, but also Bernard Edelman, the head of LaSalle Street Council. Mr. Edelman, thank you very much. All right, let the questions roll.
Hi, Jay. Dr. Simon, thank you so much for that presentation. It was very
Your
informative.
name, please, Mr. Robles?
Oh, sorry, Chris Roebling. Hi.
Hi.
Thanks very much. Very informative. And let's just go with that and say, you know, this is the way things are, and you've turned a corner. Here is another health policy question that I have not heard answered in, say, the last 25 years. And I throw this up,
Sure.
not to be difficult, but to get your sense of this.
Yes.
Because I think you've talked about being the largest in the state in various categories, and so I think all taxpayers have a right to some idea of where you're coming from
Absolutely.
on this. We are very fortunate to have two very distinguished public hospitals on the west side. And a lot of great people practice at your hospital, as we've seen. A lot of great people practice just down the street at U of I. And my question as a taxpayer is, how is it that you and your opposite number person over at U of I, how do the two of you relate to each other, and how do you relate in the provision of care, okay, to the various communities that make up your patient base, so that we, the taxpayers who are paying both to Cook County and to the state of Illinois, have some sense that Cook County may be running very efficiently now, and furthermore, we also now know that there isn't duplication or overlap between the Cook County and the U of I. If you could just talk for a few minutes.
I want to thank you for that question. That's not a difficult question. It's a wonderful question. Let me tell you the numbers, and then you'll know what the numbers speak for themselves. 47% of all of our patients are self-pay, which basically means no pay, 47%. When StockCap came in, they said you might be able to turn 10 to 15% of those into Medicaid, Medicare, okay? So, but still, right now, 47% have no insurance. University of Illinois, 7% are uninsured, 7%. So the fact is that we take care of the vast majority of uninsured. Now, how do we relate? You're absolutely right. U of I gets a huge amount of money from the state. We get some money from the county and some money from the state, but the state's money is really our money that they then keep 2/3 of. But the bottom line is that regardless of all of that, we get money, they get money. They take care of 7%, we take care of 47%. Now, how do we relate? Well, here's how we relate. When we were in this crisis in January, we were backlogged in mammograms. We were backlogged in colonoscopy. Colonoscopy is expensive, as you know. Rush, who's a private hospital that gets no state funding, and I don't say this because I'm on faculty at Rush. My integrity means far more than any salary or faculty position anywhere. What happened is that they donated at no cost, without any pre-screening, $1 million worth of colonoscopies. It totally reduced our backlog, free. U of I donated 0, even though they're state supported. Mammography, we asked them for help on mammography. Mount Sinai helped, St. Anthony helped, and Rush helped. They sent over someone from mammography to come and read mammograms, but they did not do any mammograms on site as far as I know. In the 19 years I've been there, University of Illinois and county have not, while they've gotten together in some areas, it's been a difficult relationship. I think in order to fix that relationship, it would have to be at a much higher level than mine, where people would sit down and say, you know, if you guys are both getting funding, you need to divide up services or do something like that. But right now, that's the fact. By far, the best relationship that this county has ever had is with Rush. There's no comparison. It's night and day between what we had at U of I when I was with them, and I was with them, compared to now. But that's the reality. Yes, ma'am.
I'm Joyce Saxon. I'm a member of the governing board of City Club.
Thank you.
Before I ask my question, Jay, were you and the mayor standing in the same draft? You both lost your voices. I heard him this morning. Okay. Doctor, are you going to answer me, or shall I go on with my question? Okay. Dr. Simon, in the absence of Kathy Posner, my fellow board member, who was always playing devil's advocate, and you asked for a challenging question.
Sure.
Question, there's a new appointment for $80,000, a relative of Councilman Marino. Can you explain, do you have a good reason for that?
Sure.
And that's the trouble. The papers
I
give
totally
this bad
agree.
impression. That's why you get a bad name.
And you want to know something? That's a great question. Let me just tell you something. I think it's stupid to, during this time, to have stuff like that come up. Let's say the person is phenomenal. Why not wait until after the budget is passed and then appoint them? I don't disagree with you. I wish it could be reversed too. But let me tell you about this lady. This lady was sent to me to look at and to interview. What she does is pediatric, she's doing pediatric iris referrals. Phenomenal, absolutely phenomenal. Comes in early, leaves late, takes care of everything. She's well trained for it. And she didn't get an increase. I think she was at 80,000. She was transferred from JVTC. But you know, she's a very, very good employee. And that's, to me, that's all I care about. I wish, just like what you're implying, I wish to God they'd have waited until after the darn budget passed to do that. Even though she's qualified, even though she's doing a good job, and I don't really believe she's overpaid. But I totally agree, it gives a bad taste and a bad impression.
It is the perception,
I know, and I understand, and I wish I had some control over it. That's the honest answer. But I don't. Boy, you guys weren't challenging at all, but thank you. Thank you very much.
Okay. Thank you very much, Dr. Simon. Doctor, hold on. Doctor, 1 second.
Oh, I'm sorry. Oh, thank you. Thank you very much.
On behalf of the City Club, there's a 1-year membership and a little mug. You can go around asking for money. Sufferton and Claypool and Pareka and the rest of them.
Thank you so much.
Meeting adjourned. Thank you.
Thank you so much. Really appreciate it. Thank you so much. That was great.